Taylor will be discussing breastfeeding and believes in connecting with our bodies and nature through this beautiful process.
Hello everyone. For those of you who don't know, my name is Taylor Bishop. My presentation is entitled, Is Breast Best? The Societal Stigma of Breastfeeding. I got into this topic through my interest in natural parenting and natural motherhood, and as I looked into it more, I realized that breastfeeding is much more of a controversial issue than I thought it would be at first. This led me to this really interesting topic of how society views women who choose to breastfeed their children. So this evening, I'll be discussing the way that our society stigmatizes breastfeeding and why our society has become so uncomfortable with this topic. I will discuss breastfeeding in public and how that has caused a lot of controversy, and how our society views the breast as a purely sexual object and rejects the biological wonders of the breast. So first, just a quick intro into breastfeeding, just some quick facts. Breastfeeding is recognized by the World Health Organization and the Academy of American Pediatrics as the most effective way and the healthiest way to feed an infant. Breastfeeding, of course, involves the baby's natural instinct to suckle, which induces milk from a lactating mother's breast. So for instance, this wonderful breast milk also will adapt to the needs of a child. So for instance, if a child is deficient in iron, the breast milk will pump up the iron and will provide that to the child so that they are no longer iron deficient. Or if the child's lacking in vitamin A, the breast milk will adapt to produce more vitamin A, which is pretty incredible, I think. All children have different cycles, so some babies may need to feed every hour, while some may need every 2 hours, some every 4. It just depends on the baby's cycle. There have been many, and one more thing, the nice thing is the effectiveness of breastfeeding is not related to the size of the breast. So that means anyone is available to choose this option. Well, any woman, really. There have been many replacements for breast milk that people have tried, and one of them is goat milk, but that wasn't providing all the nutrients that the child needed. So they also tried this frothy oatmeal-like substance, but it sounds pretty gross, and I'm sure a lot of babies didn't really want to eat it, and it wasn't really great for their sensitive stomachs either. So in the past, when women had trouble breastfeeding, they would usually use a wet nurse, which is just someone that would come in. And 100 years ago, it was more someone that had just had a child and was lactating and was able to provide for that baby. And in the Victorian era, it became more and more popular for a mother to hire a wet nurse because in the Victorian era, it was considered indecent for a woman to breastfeed. In World War II, or after World War II, the use of formula became much more popular, and the use of it really increased at a dramatic rate. Between 1955 and 1965, we're seeing a record of about 80% of women were choosing to bottle feed their children. Now, popularity has grown again with the rise of the third wave feminist movement, as well as the green movement that we've been seeing lately. There are a lot of pros to breastfeeding, especially for both the mom and the baby. Short term, you are not on your period while you're breastfeeding, which is nice for some people. It's a pretty effective form of birth control. A woman's body is set up so that if she's providing for an infant, your body knows not to provide another infant for her to care for. And it really helps to strengthen the bond between the mother and child. When someone is breastfeeding, there is a powerful hormone release called oxytocin. And you may recognize this as what's called the love hormone. It is released during orgasm, during childbirth, and it is also released during breastfeeding, and this allows for the mother to build a strong bond with her child and become more nurturing. And a woman burns an average of 500 calories during a nursing session, so for some women, it's also an effective form of weight loss. Long term, it can reduce the likelihood of post-birth bleeding. It can reduce the risk of breast cancer, ovarian cancer, and endometrial cancer. It can reduce the risk of osteoporosis, rheumatoid arthritis, heart disease. Mothers that are diabetic will need less insulin when they're breastfeeding, and it helps the woman to be less prone to postpartum depression. Some pros of breastfeeding for the baby are stronger immune system, and fewer infections will lead to fewer infections. The reduced risk of sudden infant death syndrome and acute inflammatory disease, reduced likelihood of diabetes, obesity, and allergies later in life, and reduced risk of asthma, celiac disease, breast cancer, and cardiovascular disease. However, you may have heard a study that says that breastfed babies are more intelligent, and that is not true. They have not found any biological links to that. It just has to do with how much time the mother and the baby are spending together and how that echoes later in life. Some cons of breastfeeding are that it is very difficult for some women and it is very time consuming. The mother has to keep up with these hourly cycles that the baby is going into, and she has to be available every few hours to nurse. And this can be really difficult for a mother who would like to go back to work after her child is born. So mothers in this circumstance will often choose a breast pump, but that can be very difficult as well because it can be very painful for the woman. And breastfeeding burns a lot of calories, like I said before, so women can be very tired, very fatigued, and it can lead to anxiety and frustration with their child and with pretty much anything else that's going on. You know, when you're tired, it affects the rest of your life. There are some risks of choosing to give a child formula, just like there are some issues with breastfeeding. There are some risks with formula. It can double the risk of a child's death in the first 6 months of their life. It can increase gastroenteritis by 5 times, and a child is 5 or 8 times more likely to develop lymphatic cancers on formula. Now, the heart of this is public breastfeeding and is very controversial, and there are some misconceptions. It is in fact legal for a woman to breastfeed in a federal building, or on federal property, but there are really no laws about to allow or to prevent someone breastfeeding in a private location like a restaurant, because those are not owned and they're regulated specifically by the specific owner, and that is still illegal. Some women have undergone a lot of criticism and, in some cases, legal action for breastfeeding in places like Walmart, restaurants, and a woman was actually, legal action was taken against a woman who was breastfeeding in her OBGYN's office. In fact, a family restaurant owner in a location where he was interviewed said that something like breastfeeding belongs in a pornographic movie or a brothel, but is certainly not for a family restaurant, which I find a little ironic. And like I said, they have been arrested and charged for things like this. And also in certain surveys that have been done by the American Dietetic Association, they have found that 52% of people that they interviewed said that they didn't believe that a woman should have the right to breastfeed in public. And 72% of people that they interviewed in the same study decided or believed that